what are the options and the recommendations for folks for prevention of flu and COVID and RSV, which were the triumvirate of the triple-demic last year. Today, we have invited our doctor friend and an expert in infectious diseases to explain the viral landscape in the U.S. in the autumn of 2023. After today's episode, you'll feel empowered to make your own personal vaccine choices based on your risk factors and the epidemiologic evidence and straight from the source data-backed recommendations from Chicago's Fauci himself.
Oh my gosh.
Jeremy, are you ready to gab about getting the jab?
I don't deserve you.
Let's do it. All right, welcome back to your doctor friends. It is my absolute pleasure to introduce you, reintroduce you to our expert today. He's our favorite infectious disease expert, Dr. Rob Citronberg. You may remember Dr. Citronberg from our previous episode about monkeypox, which also kind of talked about COVID and polio, and it was posted almost exactly a year ago. So happy your doctor friends anniversary to Dr. Citronberg. Briefly, Dr. Citronberg is the Executive Medical Director of Infectious Disease and Prevention at Advocate Aurora Health. He is a very trusted news source as an infectious disease specialist. So, Rob, Dr. Citronberg, welcome back to the pod.
Thank you, Julie, for that kind introduction. And Jeremy, nice to see you as well, too.
For sure, man. So we're going to bring back our virus expert to just give us fall previews every single year.
Let's start with an orientation to the viral climate in the U.S. right now, Rob. What temperature are we at, would you say, when it comes to COVID and flu and RSV right now? Where are we at?
Overall, pretty cool. It's still early in the wintertime virus season. There was a lot of COVID circulating. It was started in the southern United States. Now there's more really everywhere, but nowhere near the levels that we saw last year or the year before. And I think what's the most important thing about that, too, is that while there are some patients who are being hospitalized for it, the need for critical care is really, really low. Only occasional patients need to be in the ICU, which is, as you know, a huge change from how it once was. Yeah. So COVID levels are higher. There's actually some evidence that the current wave of COVID is peaking already. Start early, finish early, may come back later. There's really been minimal flu activity, only a little bit in the southern U.S. Again, it tends to start in the south and move up more towards the north. We had a lot of interseasonal RSV in the summertime. There are some sporadic cases right now, but I wouldn't say we're seeing a surge of RSV at all. So overall, I would say the temperature is pretty cool, but we're always keeping an eye on it. Things can change week to week.
How do we know this? Where do we get the data from, roughly?
You mean aside from listening to me?
Yes. Show your receipts, Rob, is what I'm saying.
Just to know I'm not making it up. Well, flu and RSV are pretty easy because CDC publishes flu and RSV activity every week. So it may be a week behind by the time you get it, but it's published every week. COVID's a little trickier because we don't really test for COVID anymore in labs. Only a very, very small percentage of patients with COVID are tested in labs, and those are like pretty much hospitalized patients. Mm-hmm. Everybody else does home tests. So we have no idea what the true number of COVID cases is. It's probably a lot more that's reported because people are doing home tests. So it's actually harder to track COVID cases. I think COVID hospitalizations is easier to track and is a reasonable surrogate for the number of cases. There's some interest in looking at wastewater surveillance for COVID activity, which I think gets mixed reviews about how accurate it is, but it probably gives you some idea if there's COVID circulating. Pretty hard to pinpoint a number of cases, though. Hospitalizations, yes. Cases, no. But influenza and RSV are pretty easy. And I think we're all sensitized to COVID. We hear about COVID and we shudder, but I think there's not too much to worry about. I think we just are rational about it and try to get on with our lives best we can. But that's really what's circulating right now.
How much, in your opinion, did the restrictions during the real meat of the COVID-19 pandemic alter the seasonal patterns of COVID, flu, and RSV? I feel like that was the big discussion that we had when we had a similar conversation with you last year, that everything kind of shifted because of being indoors and all of the sort of mandates and such. Do you feel like it's all that different than it was last year?
It's a really interesting question. I think the most notable or important observation was actually in 2020, and 2021 when everyone was masked, right? And when everyone was masked, there was no RSV, there was no flu. Like nobody got a cold, anything that wasn't COVID. And so that to me, that told me is that, yeah, masks actually do something.
Right.
Masks and hand washing really work. But I think it's hard to pin a cause and effect on ultimate seasonal patterns because there's so many variables that go into when these viruses emerge. Like, for example, last summer, we saw a ton of RSV, like in the summertime, we never see it. We're not seeing that this year. And in some years, we have early influenza. Last year, we had a very early flu season. This year is not. Could it be related to patterns of masking? Yeah, I guess it could, but it could also just be the natural variations that we see in the viruses.
So RSV is widely known to be a dangerous respiratory virus, especially for vulnerable populations. Rob, can you give us an overview of RSV? Like, who's the most vulnerable people and what kind of illness does it typically cause?
Yeah, like a lot of other illnesses, Julie, it's the very young, the very old, and the infirm, right?
Yeah.
So RSV is an interesting virus. It can actually cause very severe infection in the lungs, bronchiolitis, and it's particularly bad in infants, sometimes in premature infants or even older babies who have some chronic conditions. And we also see it in adults too, but typically older adults, those also with chronic lung disease, frequently in nursing home residents. Clearly, the biggest focus is on the babies, but definitely we do see RSV infection every year in some of our seniors as well.
Why don't we make this like really, really clear and simple and break down the recommendations for respiratory viruses with vaccines available this fall? Rob, what are your thoughts about that?
Yeah, first, just to start, this is the first year we actually have had vaccines for all three viruses, which is pretty exciting. And we are recommending that people get the COVID vaccine this year, in large part because it is updated. It covers strains that prior vaccines didn't. And also, people haven't been vaccinated in a long time, like a year and a half, 2 years. They stopped getting boosters. We know only a very small percentage of people were getting boosters. So we do recommend the vaccine for most people. Can I say everybody should get it? No, I think it's clearly very advantageous for people who are older, chronically ill, the ones who are, if they get COVID, could die from it. But I think the argument's a little murkier for young, healthy people, particularly kids. But the way I look at it is I want to get my target populations first, which are elderly, chronically ill. Those are the ones I want to prioritize. I'm not going to preach to everybody, oh my God, you got to go run out and get the vaccine tomorrow. But I am going to do that to people who I think are at risk for severe illness. So, and you know who you are if you're one of those people, you've heard it now for the last 3+ years. Those are the people that we're really going to try to target with our efforts. I think we're going to do away with the term booster, which is something that's kind of long overdue. It's really just trying to do is roll this into an annual COVID shot, like you get your flu shot, like you get your RSV shot. Forget about primary series, forget about boosters. I think those terms are pretty much gone.
So another situation when myself or somebody who maybe isn't in the high risk population sees that new booster come out, and maybe I'm not going to be doing anything high risk until I'm going to go to Thanksgiving or go to Christmas and see somebody that's higher risk. Should I wait and delay and get it closer to that time?
I would probably get it when it's available. When you try to game the system for best timing, sometimes you miss. We do recommend that with like flu shots, for example. You try to time it so that it's not too early, not too late. And with the COVID vaccine, I would say just get it when you can, and don't worry about timing it so much. That should provide adequate protection for Thanksgiving time, Christmas time.
Jeremy, stop saying booster. Rob's trying to make fetch happen with annual shot.
RIP booster. I will, very all about inclusive language here, except for the word booster, which is no longer included. I know that they're trying to talk about maybe getting your COVID and your flu and everything all at the same time. It's kind of like that salesman technique where like you have them there, you got to do it because they may not come back type of situation.
I think it's probably a good idea because, as you mentioned, a lot of patients only, especially those with maybe limited transportation capability, they can only get there once. And if that's the case, they should get all the vaccines that they can get. There's no reason why you cannot get flu and COVID on the same day. In fact, you probably should just get them in different arms. There's actually, interestingly, recent studies that show your immune response to the COVID vaccine may be better if you get it in the same arm that you got your last COVID shot in. So if you can remember
Ah.
which arm you got that one in, say, well, maybe put the COVID shot in that arm.
Well, maybe if you're like me and you take photographs every time you get these injections, then you don't have to worry because you could just go through your Insta and be like, oh, it was my left arm that time.
Exactly.
Back on track. So we basically just touched on influenza. So the annual flu vaccine is recommended for everyone 6 months and older. You know, it's most important for adults ages 65 plus, although 65 isn't some magic number that makes you frail. And then people under 5 with weak immune systems. Anything else that you would add on about influenza specifically?
I think that people are pretty accustomed to flu shots. And I think it's actually one of the strategies to make the COVID vaccine feel just like the flu shot. Just so it's something you do every September. You get your COVID vaccine and you get your flu vaccine. But I think people at this point have pretty much decided whether or not they're going to get their flu shot every year. I don't think we're going to change too many minds with that.
You never know, Rob. People might see you and be inspired.
Do we talked about the current climate, and you said it was cool, but like, do we have a forecast specifically for flu?
Hard to tell. I think sometimes we look at what happens in the southern hemisphere as a preview, but there's so many variables. We can make predictions, but I think they're really just educated guesses in terms of what's actually going to happen. Anyone's guess.